This video is to help demonstrate how to manually prone a patient. Once face and body prep has been completed, gather supplies, set up room, and assemble team. Supplies needed are 3 flat sheets, arm cradle foam, prone pillow head positioner, incontinence pads, and pillows. In the first pillowcase, there will be chest foam and 1 pillow. Foam is always placed to chest. Second pillowcase will have 2 pillows that will be applied later to the hips. Third pillowcase will have 1 pillow that's applied to the shins. Room setup. Position bed at an angle away from the wall. This will allow RT to position at head of bed. Remove headboard and place backboard or headboard between mattress and frame. This will hold the prone pillow. Ventilator, IV pumps, tube feeding pump will be positioned near head of bed. Urinary catheter, after emptying, or FMS will be positioned between patient's legs. Supplies should be near end of bed. Team members include respiratory therapists positioned at the head of bed. He or she will be responsible for stabilizing the head and maintaining the airway as the patient is positioned prone or supine. Team leader, positioned at the side of the patient, will direct the team during pronation and supination. Patient nurse will assist in pronation and supination of the patient. This may or may not be the team leader. He or she is responsible for assessing the patient and reestablishing monitoring. Additional clinical support of 3 to 4 is needed to assist the team with supination or pronation and to ensure patient safety. Minimum of 5 persons. The team leader will direct the team. The primary nurse or member of the team will need to be included with the turn team. Address the patient and explain the procedure. Raise bed height and lower all side rails. The primary nurse will direct the team to disconnect and remove any unnecessary tubes equipment on the anterior aspect of the patient, like electrodes or a stat lock. A flat sheet should already be under the patient on a Syntec mattress. Ensure the flat sheet is completely under the patient and pull the sheet tight to decrease any wrinkles under the patient. Make sure that the patient is completely flat on his or her back and tuck patient's hands underneath each side of the hip so that the patient stays tucked during the turn. Place an incontinence pad face down over the pelvic area of the patient. Then place a flat sheet over the patient and pull each side tight to remove any wrinkles. Place the memory foam and single pillow over the chest, foam side down. Double pillowcase across the hips, and 1 single pillow over the shins. Place another flat sheet over the patient and pull each side tight to remove any wrinkles. Ensure arms are positioned thumb to bum. The patient will be turned towards the ventilator side. Members of the team on the ventilator side will roll all 3 sheets down, making sure to roll under the patient's arm. Members of the team opposite of the ventilator side will roll all 3 sheets up. Roll the sheets as snug as possible to turn the patient. The tighter the roll will ensure the pillows will not move during the turn and the patient will be secure for the turn. RT will ensure the ventilator is close with enough tubing provided for the turn. RT will protect and stabilize the airway. Time out with your team and make sure everything is in place before going into the proning process. On RT's count, slide the patient away from the ventilator laterally.
1, 2, 3.
Again, on RT's count, move the patient straight up so the patient's head is hovering over the bed.
1, 2, 3.
Onto the prone pillow. On RT's count, turn the patient onto their side towards the ventilator. At this point, the members on the ventilator side will grab the roll from the top, and the members on the opposite side of the ventilator will grab the roll from the bottom. This may take some time to make sure everyone has a good grip on the roll.
1, 2, 3.
RT's count, completely turn the patient to the prone position. Again, on RT's count, move the patient straight up so the patient's head is hovering over the bed onto the prone pillow. Time out. Primary nurse will assess the patient and RT will assess the airway. The primary nurse and RT will ensure the patient's head is in proper position and pressure points are addressed. Under the direction of the team leader, unroll the sheets and look to see if the patient is in a neutral position. If the patient is not in a neutral position, use the sheet under the patient to adjust the pillows to bring the patient to a neutral position. If needed, grab all sheets under the patient to move the entire setup. Ensure toes and knees are offloaded. At this point, team members can apply electrodes to the back of the patient to reestablish monitoring. Position the patient's arm in a swimmer position, one arm up and one arm down. Do not overextend the joints. Place pillows under the patient's arms. Elevate foot of bed fully to prevent the patient from sliding down before placing the patient in reverse Trendelenburg. Patient should be placed in reverse Trendelenburg at approximately 10 to 12 degrees. The primary nurse will reconnect any tubing or equipment. This concludes our manual prone video.